Alcohol dependency is a huge problem. Now, the younger generation are actually starting to move away from drinking alcohol excessively, but certainly for patients in their 30s to their 60s, we are seeing an increasing number of patients with significant alcohol-related problems. In the olden days, we used to refer them to as alcoholics, but now we tend to use alcohol dependency, alcohol abuse disorder, and so on and so forth. What we used to do is refer the patients to the community drug and alcohol team, and they would disappear into this referral system, usually emerging some weeks or months later, little better than when they went in. We now understand far more about the mechanism of alcohol dependency. There was a chap called Sinclair who did some experiments in Finland a good few years ago, and he found out that those who suffer from alcohol dependency issues release hormones called endorphins when they drink. Now, endorphins are the pleasure hormones. Normally you or I might have a spicy curry or go on a roller coaster or do something exciting and you get a thrill from it. But people with alcohol dependency disorder, they actually get a similar thrill from drinking, which rewards them, and they carry on drinking. Now, if you can block these endorphin receptors with a drug called Naltrexone, it drastically reduces the amount of alcohol these patients drink. And it's named after the chap who discovered it, Sinclair, so-called Sinclair Method. So if you are going to be in a drinking situation, you take a pill 90 minutes before the first alcoholic drink, gets into your system, blocks the receptors, so when you drink, you no longer get the reward for drinking alcohol. So a person with alcohol dependency, so long as they take their tablet before any alcoholic drink, will be able to drink like a so-called normal person. So instead of having to avoid alcohol for the rest of their life, why should they be the only one who can't raise a glass at their daughter's wedding or go on a hen weekend or a stag weekend with their friends? So long as they take a pill, they can have a couple of drinks and then say, that's fine, I've had enough. That doesn't work with any other method. Success rate when you follow the method, well into the 90%, compared to things like rehab and various community-based alcohol projects where the success rate is less than 10%. So to find out more about the Sinclair Method, visit the clinic website or give us a call, and we're happy to talk more with you. Everything's in complete confidence, so we look forward to seeing you.